here at the Real Alcázar, Royal Palace here in Seville. For us, it's a great honour to welcome you, both those who are here in person and also those who are connecting remotely. Welcome to this session, to this high-level meeting of the Spanish presidency of the European Council, which is entitled HIV in Human Rights, Political Action to Achieve Zero Stigma, which is the topic that we will be discussing today. My name is Julio del Amo. I'm the director of the division responsible for HIV control and sexual transmission diseases control and tuberculosis of the Ministry of Spain. And I'm accompanied by the co-moderator, Mr. Binod Mahanty. In this session, we are going to address the political response on the part of EU member states currently in place and those that will be implemented in the future in order to eliminate stigma and discrimination related to HIV. And to start, we'd like to hand the floor to the Mayor of Seville and express our deep thanks for his hospitality and generosity in hosting this event here in the city of Seville in this wonderful palace building. Good morning, distinguished Minister of Health, Minister of Hungary, Minister of Health of Hungary, Minister of Health, the representative of control of infectious diseases, and also the representative of the WHO responsible for prevention and control, the local cooperation division, the Socialist Party representatives, and the delegates who are participating in this high-level meeting. For me, it's a great honour as the Mayor of Seville to welcome you here to our city, and specifically to the Real Alcázar, the Royal Palace building, which is a unique, emblematic location here in Seville. We're holding this event here in the Almirante room, which has been a witness in first person of the written history of the city of Seville. To give you an example, between these walls, below this ceiling, Magellan and Juan Sebastián Elcano planned the first trip around the world, and when Juan de la Costa prepared the first Mapa Mundi in history. At that time, gateways were open to the Indies, and also one of the most important cities in the world. Today, Seville, once again, occupies a relevant place thanks to this high-level meeting, whose aim is to progress in relation to justice and achieve zero stigma with respect to persons with HIV. I have to inform you, additionally, that Seville is the first Spanish city which adheres to the fast-track strategy, HIV and AIDS-free cities, signing the Paris Declaration and also constituting the fast-track committee for Seville to achieve HIV-free cities. It's important that we work in collaboration with the major representatives and entities in the sector. Thanks to the fast-track committee, the plan was approved for a HIV AIDS-free city 2023 in Seville. We're currently working on the 2023-2028 plan, which will be the second plan of this type. And I can also mention that in addition to these actions, we will shortly launch a pioneering service to provide support specifically to fight against the harmful effects for health of same-sex diseases. Our cities acquired protagonism in this respect to improve the health of persons that will use these different mechanisms with the collaboration of the main associations and entities that work in this sector with a view to implementing this service. I'd also like to take this opportunity to thank these entities for the work that they're doing, and particularly Adara and Ectosida, who are represented here in today's meeting. I would like to announce that we're also working to increase the budget assigned to these type of mechanisms within the scope of the different conventions and agreements in order to reduce and bring to zero the stigma associated and discrimination of persons with HIV until we achieve their full elimination, because it's time that we end these stigmas. We have to raise awareness, increase understanding, and foster greater empathy, and also provide greater health support. Together we can build a world in which persons with HIV, live free of fear of stigma and discrimination so that they can lead full and healthy lives. I hope and I desire that this high-level meeting, together with the different events that the consistorial house that the town council is also organising for these 2 days, will be fruitful to achieve the necessary justice and achieve zero stigma in our society. In this way, we can ensure that Seville will continue to write its name below different achievements in our history, which I'm sure will eventually result in collective benefit for all of society. Thank you very much for your attention.
Thank you for your welcome and your hospitality in the beautiful Real Alcázar of the city of Seville. Good morning, everyone. And my name is Binod Mahanty, as my gracious co-host just introduced. I'm the deputy head of the unit for infectious diseases in the German Ministry of Health. I'm also responsible for HIV, hepatitis, and STIs. Stigma and discrimination continue to be an important barrier for key populations to access HIV services, also in my country. Recent studies that we conducted, including the Stigma Index, have shown the challenges that key and priority populations face in accessing HIV services, including due to stigmatization attitudes of health workers, something we had discussed in detail yesterday at the technical consultation. And as the chair of the UNAIDS Program Coordinating Board this year, Germany was proud to have initiated, together with like-minded countries, a full day on the issues that transgender and gender non-conforming people from different countries have faced, including when accessing HIV prevention services. Therefore, I want to really thank the government of Spain and the Minister of Health, Señor José Manuel Miñones, for putting the issue of stigma and discrimination on the agenda of their EU presidency and for hosting this important event today. With these words, I would like to give the floor to the State Secretary for Health of Hungary, Dr. Péter Takács.
Thank you. Can I have my slides on the... Oh, there is it. Oh, thank you. Honorable Minister, dear Jose, my friend, thank you for hosting us, and thanks for the Spanish presidency to keep this very important topic high on our agenda. Dear directors, mayor, dear participants, I'm honored to have this opportunity to address the highly relevant issue of stigma and discrimination related to HIV and share the Hungarian measures with you. To put the Hungarian responses targeting the stigmatization in context, let me allow to provide an overview of the overall situation of HIV and healthcare framework in Hungary first. So, what is HIV exactly, and why is HIV so dangerous? As we all know, the virus targets the body's white blood cells, weakening the immune system. In consequence, the infected person may contract diseases such as tuberculosis or infections and some cancers. If not treated, it may lead to acquired immunodeficiency syndrome, known as AIDS. HIV spread from the body fluids of an infected person, including blood, breast milk, semen, and vaginal fluids. What is the current status of HIV in the world? According to the statistics by UNAIDS, in 2022, approximately 39 million people across the globe were infected with HIV. 37.5 million were adults, and 1.5 million were younger than 15 years old. 53% of the infected were women and girls. Data on the infection shown on this slide. As you can see, Hungary is one of the countries with low HIV prevalence and low case numbers. Professional coordination ensures that the infection rate stays at low level. Data are encouraging, good practices are preserved, and the continuity of relevant healthcare services is a priority. This table presents how HIV is distributed by risk groups in Hungary as of 2023. I would like to draw your attention to the maternal distribution, which is extremely low, only 10 cases in 37 years. Allow me to provide with a short overview of the treatment of HIV infection in Hungary. HIV infection can be treated with highly effective medicine called antiretroviral therapy, ART, a combination of drugs that interfere with the HIV virus replication cycle at different points. With adequate adherence in serostatus positive individuals, the virus can be kept below the limit of detection, but not permanently eliminated, while medication can greatly reduce the ineffectivity of an HIV positive person. People on ART take a combination of HIV medicines called HIV treatment regimen. A person's initial HIV treatment regimen generally includes 3 HIV medicines from at least 2 different HIV drug classes that must be taken exactly as prescribed. There are several options that have 2 of 3 different HIV medicines combined to a once daily pill. Long-acting injections of HIV medicine, even every 2 months, are also available if the healthcare provider determines that you meet certain requirements. The above-mentioned treatment can significantly slow the progression of disease. Primary antiviral care of HIV in Hungary is centralized. The South Test Center Hospital, National Institute for Hematology and Infectious Diseases, the DTC, is a national center with 15 beds in active inpatient care and 55 specialist hours per week in outpatient care dedicated to care of these patients. In addition, in the center hospital, the 3 centers across the country are also entitled to prescribe 37 medicines for HIV for a minimum reimbursement of less than €1 per box. In addition, to the centers, you can see on the slide the care of diagnosis HIV patients and the treatment of secondary complications, for example, infections caused by virus infection, are provided by infectology centers with nationwide coverage. HIV is a medical condition that carries a lot of stigma, usually due to a person's lack of information or moral judgments about how someone has contracted HIV. The reason behind this is that HIV is mainly transmitted through various sexual relationships, and it can also be linked to activities such as intravenous drug use. The stigmatization of people living with HIV has a negative impact on physical and psychological well-being with positive serostatus. In Hungary, the patient may request mental health cooperation, consultation with a social worker, or seek professional psychological support. The patient may ask support of a psychologist or specialist in the healthcare facility. Stigmatization may discourage an individual from participating in screening. It can be an epidemic threat and may also lead to social exclusion and isolation of the patient. Following stigma-reducing factors can be considered during the diagnosis and care of HIV patients. HIV screening can be done anonymously. HIV screening is free of charge in Hungary. HIV counseling is provided free of charge at the time of the blood test or when the positive result is received, and in case of positive results, admission to care. The hesitancy of being screened, consequently the lack of diagnosis, is an epidemiological risk. The stress associated with HIV infection can affect the mental health of the patient concerned. People living with HIV are more likely to develop mood, anxiety, and cognitive disorders. Depression is one of the most common mental health conditions which affects people living with HIV. Higher levels of depressive symptoms are associated with poorer physical quality of life, which causes the disease to progress. As you can see, in March 2022, UNAIDS initiated a special briefing for the countries most affected by the refugees crisis from Ukraine, including Hungary. The reason for the briefing was that Ukraine is the second most affected country by HIV in Europe. International program officials stressed that one of the main priorities of the moment is to ensure continuity of medical treatment for the population concerned. Hungary has been prepared to provide care for refugees with HIV, and the following measures have been taken to this end. The Southwest Center Hospital and the National Institute for Hematology have been designated to treat HIV or AIDS patients. For epidemiological purposes, in view of its special nature, the Chief Medical Officer issued a decision on the 11th of March, which obligated and designated the Southwest Center Hospital for the medical care of persons suspected and infected with HIV crossing the Ukrainian-Hungarian border. In case of suspected infectious diseases, care is provided on basis of a referral from the general practitioner or specialist treating the suspected HIV-infected person. The patients are transported in accordance with the rules of the transport of infectious patients. Designated service provider is obliged to report infectious diseases to the public health department of the district or precinct office responsible for the area, which will be the necessary measures. As a result of the low prevalence and cases of HIV in Hungary, there is a limited NGO presence with organizations dealing with discrimination, stigmatization, and patients' rights. The Background Society, the Positive Life Foundation, the Red Cross Shield Association, and the Anonymous AIDS Counseling Service. In Hungary, there are 8 pieces of legislation are in force related to HIV, non-discrimination in the forms of acts and minister decrees, as well as the fundamental law of Hungary. HIV patients are mainly treated by dermatologists and immunologists, but the care is interdisciplinary. They receive the same non-discriminatory care under the same medical ethical rules. In 2013, a national HIV task force was established in Hungary as an advisory body of the Minister of Health to promote the fight against HIV in Hungary and to improve its professional management. The development of a national AIDS strategy is currently under consideration. We are looking for best practices in our aim to keep being updated. Our goal is to work at international level together, and I ask your help in this program to make people's lives with HIV better and easier. Thank you for your kind attention.
Thank you, Dr. Takács, for your insightful presentation and remarks on the situation in Hungary, including how you're supporting the refugees from Ukraine. I think you've set a nice tone for this opening session. So I would now like to continue with a short video message from Ms. Stella Kyriakides, the European Commissioner for Health and Food Safety, who was unfortunately not able to attend this meeting in person, but who has requested us to share her pre-recorded statement.
Distinguished guests, colleagues, friends, thanks to prevention measures and medical progress, the human immunodeficiency virus, or HIV, can now be compared to other chronic diseases. Yet, we tend to forget that HIV/AIDS remains the 6th largest cause of death worldwide. Too often, people living with HIV still experience stigma, including when they seek health care. That very stigma, or simply the fear of stigma, can prevent others from getting tested, making it harder to mitigate the epidemic's impact. I'm therefore grateful to the Spanish presidency of the Council of the EU for organizing this very important meeting. We have worked tirelessly to make a European Health Union a reality, to set the founding blocks of a stronger Europe in the area of health, be it to prepare for future health threats, have a more dynamic and fairer pharmaceutical sector, or tackle cancer. The foundations of this union are now firmly in place, and our work on HIV should be seen under the same light, that we can achieve more when we work together as a union. And as part of the European Health Union, we work on many fronts with EU member states and partners worldwide to tackle HIV. The Commission supports their efforts to meet Target 3.3 of the United Nations Sustainable Goals. That is, to end the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases, and combat hepatitis, waterborne diseases, and other communicable diseases by 2030. The EU Health Security Committee takes stock of member states' progress towards that target, and the ECDC offers guidance to countries on matters like pre-exposure prophylaxis and harm reduction strategies for people who inject drugs. In addition, the Commission facilitates the work of stakeholders through the EU Health Policy Platform. One of its thematic networks recently presented a joint statement to address stigma experienced by people living with HIV. And finally, the new public health expert group is able to work on ways of successfully addressing stigma, using initiatives like targeted calls on our best practice portal. Friends, HIV is both a health and human rights issue. Where we do not uphold human rights, HIV is able to spread. In turn, HIV can act as a brake on human rights. We need to break this vicious cycle, together and in union. And the Commission is determined to play its part. Let us join forces to remove the stigma around HIV once and for all. Thank you.
Thank you, Commissioner Stella Kyriakides, for these inspiring words. And now I'd like to hand the floor to the Regional Minister of Health of the Regional Government of Andalusia, Caterina Sanchez. Good morning. Welcome to Andalusia and welcome to Seville. Distinguished Minister of Health, Distinguished Minister of Health of Hungary, Mayor of Seville, Secretary of State, Director General of Public Health, Director General of Public Health in Andalusia. Well, I would like to thank the Ministry of Health for having given us the opportunity to talk about human rights and stigma. It's been many years now that we've been living with the virus AIDS in our society, but we continue to talk about stigma today. I believe that as a society, we have learned, or we should have learned, from the experience over all of these years, perhaps due to the impact of another virus, COVID, which has demonstrated how everyone, the whole world, has been so vulnerable when faced with this virus. And this should prompt us to reflect and consider that so many years should not pass, and that we continue to talk about stigma in relation to another virus. Perhaps we're not doing something right, and it's time for us now to talk very seriously and with contrasted information to back us up, to ensure that our children, young people, can live in a future in which this stigma has been ended completely. Our society has forged forward and struggled together, and our health professionals have managed to overcome this COVID virus. And over many years, there are organizations such as ADARA that have been there at the forefront, fighting against this stigma, attempting to open the eyes of society and the administration to this problem. So I believe that we have to work together to eliminate stigma and to work on promoting and awareness raising and prevention with our young people, our children, and end AIDS. In Andalusia, we've managed to achieve this objective of 90%, 90%, so that we can then move on to work towards the next objective, 95, 95, 95. I'd like to thank the European Union and the Ministry of Health for giving us this opportunity to talk about this subject of great concern to all of us. We have to work together as a society to overcome once and for all the prejudices associated with people with AIDS. What they have is a virus and a health problem. Thank you very much. Thank you very much, Regional Minister, for these important words, which I'm sure we all share and embrace. For now it's an honour for me to hand the floor to the Secretary of State of Health of the Ministry of Health of Spain, Dr. Silvia Garzón. Okay, we'll then move on to the Minister. It's also a great honour to hand the floor to the Minister in her place. It's a very special honour for us, distinguished Minister, particularly for having established the fight to end stigma and discrimination as a priority for the Ministry. The Minister of Health of Spain, José Manuel Miñones. You have the floor. Well, these type of things happen occasionally, don't they? Good morning, Secretary of Health, Minister of Health, Hungary, Péter, Distinguished Mayor of Seville, Regional Minister of Health, Subdelegate of Government in Seville, the Director Generals of Public Health, authorities, colleagues, experts, speakers, friends, ladies and gentlemen. Today, Seville is hosting this high-level meeting of the Spanish presidency of the of the European Union Council, and for me it's a great privilege to be here to inaugurate today's event, something that we've really been looking forward to for many days. This opportunity for us to discuss, to raise awareness about stigma and discrimination in relation to HIV, and with a single objective: to forge a fairer Europe, particularly in the field of health. And I would like to start by expressing my thanks, first of all, the City Council of Seville and its mayor for their collaboration and support to ensure that this high-level meeting can be held in this wonderful Real Alcázar Palace building. Thank you very much, Mayor of Seville, for your collaboration and for all of your hard work in making this event a reality, and also the Regional Minister of Health for accompanying us on this very important date. And I'm sure that great progress will be made as a result of today's meeting, together with important conclusions. And of course, I would like to thank all of the experts, professionals, researchers who are participating in this event, and also the activists who seek to promote an adequate response, which will not just be exemplary, but also transformative, to transform knowledge about this disease and do away with this stigma, which has been mentioned by the previous speakers. I think that we have to speak very clearly. There continues to be a stigma associated with this disease and also with its patients. And it's been 8 years now since the heads of state and government approved the 2030 Agenda for Sustainable Development. This was an action plan that was designed specifically to support persons and prosperity. The agenda establishes 17 objectives with 173 let's say, goals. And there's a very clear mandate established to end the AIDS epidemic by the year 2030. In this morning's session, we will learn firsthand about the work that's being carried out throughout Europe. But I would like to take this opportunity to focus on an additional situation which is of equal concern, which has been mentioned by the Commissioner in her video and also the Regional Minister, namely the whole issue of stigma. Very few infectious diseases throughout history have suffered from the levels of stigma and discrimination as those accompanied by persons with HIV, a taboo which has had a tremendous impact on persons with HIV and their lives, making it difficult to achieve the control and elimination targets that have been set in relation to the epidemic. And we shouldn't speak using the past tense when we refer to the stigma, but rather use the present. A few months ago, I had the opportunities to converse with representatives of Thesida, who expressed their views on the reality that faces many of these people with HIV and also the problems facing the health sector. And they gave examples for something so simple as receiving treatment in emergency services. And according to the UN mandate, we are obliged to guarantee the rights and the dignity of persons with HIV. And it's a task which our country has to work on to progress in this field. But this has been prioritized for many years in Spain thanks to the work of wonderful professionals whose achievements and work I would like to acknowledge here today. The Ministry of Health's commitment to protection and to the fulfillment of human rights in relation to HIV is something that we tried to reflect in the strategic action on the prevention and control of HIV infection and also STIs 2030. It's a roadmap which is supported by other pioneering initiatives such as the development of the Social Compact Agreement on Non-Discrimination and Equal Treatment in relation to HIV, and of course something that was launched in 2018, and also the approval of pre-exposure prophylaxis, which was undertaken initially in 2018 to ensure its uniform application and implementation throughout the country. Other challenges that we've also tackled in recent years, and which have been crucial, have focused on adapting our legal framework And it may seem surprising, but the legal framework or legislation in Spain continued to discriminate people with HIV. To give you some examples, the prohibition of holding posts associated with security jobs has been eliminated. Also, access to public, let's say, civil servants' jobs because they have HIV. This is something of the past, but this necessary work cannot be done without allies. Allies who can help us to examine the environment, and something that's fundamental for me, which was mentioned by the regional minister, health education. And I'm increasingly convinced about the need to implement this support and education to provide our young people with the necessary tools to address different problems associated with mental health, educating on healthy habits, and raising awareness about STIs and also the prevention of HIV and other diseases. That is crucial. And with those objectives in mind, we've developed new collaboration agreements, for example, with the Alcalá University, and also in order to develop different initiatives that will benefit society. Social action and proximity policies are aspects that have been very much in our minds. And I was also previously a member of the government in Galicia as mayor, and none of these strategies that we've mentioned this morning can be fully implemented if we don't work in collaboration with local entities and the regions or autonomous communities in Spain. And we always have to support agreement over differences and disagreements. And I would like to acknowledge Seville for being the first city to adhere to the Paris Accords in the Fast Track Cities Initiative 2015, which was referred to by the Mayor of Seville. And of course, since then, many municipalities, regional governments, and also associations of governments or communities have adhered to these initiatives. And we have to feel proud because Spain is the country with the largest number of local entities which have adhered to the Paris Agreement. The Paris Accords, 173 in fact today. And that protagonism, that leading role, is the response that we have to give as a country, but also something that we have to do in collaboration with local entities. It's a new declaration, a new global declaration, which carries a Spanish name, Seville, which enhances the value of the participation of persons with HIV in decisions that affect them, because that is so important. Today, 92.5% of persons who live with HIV are aware of their infection diagnosis, and a large percentage are receiving antiretroviral treatment, and 89.4% have now managed to reduce the viral load. So we're fulfilling these achievements of 90-90-90, which is bringing us closer to the achievements, this target of 95-95-95, presented by by UN AIDS, and which we aim to achieve by the target date. And I'd like to take advantage of this forum to announce our commitment to this, something that we will reaffirm with the signing of Spain's adhesion to the alliances of nations to end all forms of stigma and discrimination related with HIV and promoted by UN AIDS. For too long, persons with AIDS died without the necessary support and without the ability to do anything about it, being marginalized by society. I think it's time for us to settle that historical debt. 42 years after the first diagnosis of AIDS, today, in relation to Spain's presidency of the EU, we can say loud and clear that we will continue to fight. We will continue to defend those that we are fighting for, and we will continue striving to improve the quality of life of persons with HIV. So thank you very much for attending this high-level meeting, which we wanted to hold on such an important issue in Europe, namely HIV and stigma. I wish you a very fruitful day. Thank you very much, distinguished Minister. Well, I think it's very moving to hear those words about our commitment. It encourages us enormously. I would like to thank all of the participants in the introductory session, the Commissioner who's connected remotely as well, and all of yourselves, everyone who is here in person or following us remotely. And with that, we will conclude this first roundtable and we will continue with the programme. Thank you very much for your participation, and we will continue with the session.